thank you for coming today. Welcome to what will probably end up being the last session for 2020, and I think we're all pretty happy to see the last of the back of 2020. And as you can see, I managed to escape London on Saturday, and I am now at my parents' house for Christmas, and very grateful. So I hope wherever you guys are that you're doing well, and you haven't been too affected by the pretty tragic announcement that we've had recently. But yeah, I hope everybody's in good spirits. And actually, if this is your first time coming to me, just you'll know that I kind of do these webinars once in a while when I get time, because I do private ones all the time with all the FutureDoc members. However, these occasional ones are just when I get spare time to do some extra free ones. But in the future, I've got a few psychiatrist friends, and I think we're going to do a mental health and mental well-being session. And if that's something that you guys are up for and like the sound of, please, again, just some thumbs up would be really good. Just good to get your guys' feedback for what you think would make good kind of sessions other than the usual medical stuff. Cool. So I'll introduce my guest in a bit, but for those of you who are new, my name is Dr. Ashley Hilton, and I am the founder of FutureDoc, which is an online program to get people into their first choice medical school at the first attempt. And so far with our kind of coaching programs, we still have 100% record at getting people in. So, I mean, I'm sure there'll come a day where that reputation isn't upheld, but for now, we still have a really, really high success rate. And we're very proud of that because of the kind of rigor that we attribute to our training. And today we have another special guest. So I teamed up with this lady because I saw that she has an absolutely fantastic YouTube channel, and she's got really good cool videos and is a really great presenter. She speaks really well. She puts the lessons across really well to people, and then it's just very good. And you'll see when you see her speak that she has a great presence about her, and a really good person, exactly the kind of person that you'd want to find out what medical school life is about from. So I'll introduce her now. Her name is Nella Grace. Well, that's what she goes by. Her name is Petty, but she goes by Nella Grace. So Nella, if you're there, can you unmute and just give us a quick hello?
Yeah, sure. Hello. Can you hear me and see me?
Yeah, I can.
Same as Zoom line. So yeah, my name is Petty, or Nella. I go by Nella Grace on YouTube, and I am currently in my final year of medical school. I went to study abroad actually in Lithuania after I did a degree in biomedical sciences. So I applied for medical school to start off with during A-levels. I got some interviews to Liverpool. I didn't get in because I didn't get the grades that first time, so obviously disappointed. Went to do biomedical sciences, then went to do postgraduate medicine abroad, and now I'm in my final year. I'm currently on my placement in England, or in Wales, so in the UK, and yeah, so that's basically who I am in a nutshell. And I also make YouTube videos kind of to show that whole journey of medical school, what it's like abroad and things like that. So that's everything.
Yeah, absolutely. And now, thank you, Nella. And now I think would be a good time to let's so I'll give you a minute, because I always save this. Well, I always forget about this, so I'll do it now before I forget, is to give you a chance to just subscribe to both of the YouTube channels, actually, because Nella's is there. That's mine. And these links on the chat, they just, if you can't see them, just click on the chat button, and then just click them now before we close this, because then the chat goes and then you don't have access to it. So there's Nella's channel and my channel, and just make sure you subscribe, because we both have, it's high season at the moment for applications, so we've got a lot of stuff in the pipeline, a lot of videos coming out. I'm releasing videos weekly. Nella, what are you doing? Have you got lots of videos coming in the pipeline as well? As always, she's cranking them out. She's very good. Cool. So given the kind of backgrounds that Nella and I have, I probably have never told you how FutureDoc came about, but I started it actually because a few of my friends at school, at medical school, a few of my housemates wanted me to help their brothers and sisters get into medical school. and a lot of them were actually from abroad. So I started by teaching international students how to get in. And obviously Nella, having the crowd that she has quite a big international following for both people going from the UK studying outside of the UK, or from outside of the UK studying medicine in the UK, and also obviously domestic students as well. So I think it was quite a good opportunity to talk a little bit about international studies. Now, I mean, the online course that I made is specifically all about this, all about the journey from start to finish, the prep in the year before, maybe even longer, while you're getting yourself ready for medical school, and also the journey once the application starts, all the way through to you starting your first day at medical school and beyond, really. But you know, that the idea is that we help you get there. So we can do, you know, as always with these sessions, it's a bit ad hoc. Like, I have a few rough notes that I'll kind of use to guide me, but to get a bit of an idea of what kind of crowd we've got at the moment. If you guys hit the participants button along the bottom, and what I'll do is I'll ask you guys whether you are applying. Firstly, we'll do a yes or no. So yeah, hit yes if you're applying this year and you're kind of halfway through the application process, probably like around your interview stage at the moment, or no if you are not, if you're applying in subsequent years, if you're kind of preparing now to apply in the future. So yes for currently going through it, no for in the future. Okay, fine. So looking, can you guys see the results? Nella, can you see the results there? Or you've muted?
I can see everyone typing in the chat.
Okay, yeah, cool. Yeah, if you it'd be good if you just keep an eye on those questions while I'm talking. So I'm admitting people, and if any good questions come up, just feel free to interrupt me. So looking at it, I can see we're probably about 50-50 applying now, and 50, yeah, and the other 50% obviously applying in the future. So great, that's fine. So what we'll do is we will spend probably the next hour to an hour and a half just talking through a few subjects. Given that we have got some people, in fact, let's do one more poll. So everybody just clear your poll right now. So you can unclick the yeses or the nos that you've clicked. And then we'll ask a second question, which is, are you, so for whether you're a domestic student, so that means a UK student applying to the UK, for yes. And if no, click no if you are either an international, either coming from outside the UK, applying to the UK, or going from the UK outside of the UK to study. I think I said that right. But yes if you're domestic, no if you're otherwise, essentially. Okay, so a lot of domestic people. Okay, and the odd international. Okay, fine. So what I'll do is I'll briefly talk about the journey, given that it's mainly domestic. Like we'll speak mainly on the kind of domestic route, and then Nella and I can just talk how things differ slightly according to kind of whether you're applying in or from outside of the UK. And then what I will do is, I mean, obviously I have a course especially for, depending on whether you're applying internationally or applying as domestic, I have a course especially for that. So you can get lots of information there. But I'll touch briefly on that. And then we're going to talk about some common interview topics that come up, and we're going to focus on two specifically, which is your work experience and the dreaded one, which is breaking bad news. So we'll have a look at that, and if we have time, we might even go for a scenario, and you'll see my acting skills where I pose as a patient or a recipient of bad news. Okay, and if you're thinking that you might want to volunteer, start mentally preparing yourself for that now, because we'll need a brave volunteer to come and pretend to be a student in a mock scenario. Okay, great. Okay, so Nella, how are you feeling? Ready?
I'm good. I'm okay. Someone just asked if this is specifically for medicine or dental school.
This is specifically for medicine. I'm a dentist as well, and to be honest, a lot of the things overlap massively, and you can take all the principles for this, and they are essentially all the same, except for like work experiences, you know, dental work experience versus regular hospital work experience. And a lot of the things are, you know, where we say commitment to medicine, just insert dentistry instead, and that pretty much gives you the same rough, you know, the rough guide to how to prepare well for it. Cool. So let's go through. So I think what's important to know, I always think that when you're applying or preparing to apply, it's really good to know what you should be doing at each stage. Now, I find that I always tell the story that when I applied, I submitted my application and I went to something called MedLink, which is a really good conference where they teach you basically how to get into medical school. And I actually had this realization when I went there. I'd already submitted my application, written my personal statement, and I was sitting in the audience waiting for my interview, to hear about my interviews. And I just heard so much stuff about things that I should have done for my personal statement, and actually was a bit scared because I was like, oh God, I should have done all this stuff. I didn't do that. I'll need to, you know, I probably won't get offered an interview because of that. But actually what it did was made me aware of some of the holes in my knowledge and the gaps that I needed to fill. And it actually served really well because I then luckily got some interview offers and tidied up all those areas of weakness in between. So I think it's, you will have missed things along the journey. So it's always important to know the whole process, start to finish, really well. And obviously, if you know that ahead of time, it can help you prepare your application much better. Do you find that's the case as well, Nella?
I need to keep myself on mute, but yeah, completely. And I had the opposite scenario where I didn't know any access to anything like this. So I was kind of going into it blank. And which, you know, looking back now, I'm so grateful that there is, you know, it's accessible with YouTube and things like that. So I think it's very important to get any help, even before or after, at any point during your journey. You know, some people are saying they've already got interviews. Good. It's never too late to kind of get the help. So I found it the other way around, where if I'd had more help through access, I would have been able to do a lot better in all, even with the grades and things like that. So it's very important to get as much, there's never too much. Just get as much as you can from people, obviously, who know what they're talking about.
Yeah, exactly. No, I think, yeah, the more you know, the more you'll prepare ahead of time, and the easier it will go. And then we're going to talk about work experience later. And like work experience, for example, I always say it's the backbone of your interview and actually of your personal statement as well, because when you have done enough work experience, you will just intrinsically know a lot about the medical field, compared to someone who, imagine you've never seen a hospital, or, you know, I've never had to go to hospital, and you're trying to apply to medicine, versus someone who spent a few weeks getting to know the ins and outs of the system, seeing firsthand, that you can't really put a price or quantify that experience. So then when you come to interview and people ask you stuff about hospital, you don't realize how much you know just by having been there. So, and I know obviously this year it's been a bit tricky for people to get that experience, and I will talk about ways that you can substitute for being in hospital. But yeah, the point of that is that the more prepared you are, the more you have seen and done yourself, the easier it will be naturally to you without really having to think about it as much. That still means you have to work hard, even if you have done good work experience. Okay, so I'm going to talk about, so if people could just lay off the chat for 2 minutes while I'm going to quickly post. So I can talk about the process of applying to medical school, and we're going to touch on it very, very briefly. But I'm going to post the webinar that you guys may have seen. Let's have a look. So the webinar link is in the chat now. Again, remember to make sure you capture this before we'll capture it now so you don't forget. But once the Zoom call finishes, then you won't be able to access the chat. So get it now. And this is the kind of 4 key steps to successful med school entry. And this will lay out the map ahead of you. And actually, one of the things that you can get on my website is, you're saying you can't see the link?
I was about to say, yeah, I don't think you posted.
That's strange. Oh, it's showing on my chat, and then, okay, let me just try that again. Sorry, guys. Let's see. Okay, everyone go off for a second. Can you see it now? Everyone in, it's going to, Sorry, I know why. I know why. It's going to everyone in the waiting room for some reason, rather than everyone. Hold on. Everyone in meeting, that's why. Did everybody get the... Okay, is that there? Cool. Did everyone get all the YouTube channel stuff? Yeah. Nella, did you see if the YouTube channel stuff worked as well?
Yeah, it did.
Okay, cool. Zoom does this really strange thing where it flicks to, like, sometimes it'll just change the thing from everyone to just one person. So I'm bombarding the same person with 20 links and then not understanding why it doesn't work. Okay, cool. So that webinar is the 4 key steps to medical school entry, to successful medical school entry. And that, as well as if you go on the website, you can get a free PDF planner, and that gives you the timeline of how things go. And because of that, just having that timeline, it already gets you to plan ahead and you understand what's about to happen, so that you can, you can just be one step ahead of the process, and you can, tie things like your UCAT exam around your exams. You can do all those sorts of things that just make the process go much smoother, and then you're optimizing every step of the way so that you're just performing better than the average person in those fields. And just by coming here, you guys are, showing the kind of attitude of people that will do better. So, so I'll quickly talk about the journey, really. And so the first step starts with preparation. And I always say you need at least a good year to prepare for medical school. Now, how long did you know beforehand that you wanted to go to medical school, and how long did you spend preparing for it?
For me, I I made up my mind around year 9, year 10 at the time. It was either law school or medical school for me. So I decided on medicine. My mom says I was a good arguer, so I should go to law school. But year 9, year 10, I decided, and from then on, I started to look. Okay, what do I need? What kind of work experience? Because at the time, they wanted to show that you've been at it for a long time. Like you show a long, what's the word for it?
Sustained commitment. Yeah.
Yes, sustained commitment. That's the one. So obviously, it wasn't like 3 months before you said, "Oh, I want to go to medical school." So around year 10, I'd say I started to prepare and get my work experience in, and start looking how to even get in, things like that. And then obviously for more specific things like the aptitude test and things like that, that's closer to the time of actually sending your application the same year. But that's why the timeline is very helpful, because you need to know, you don't want to start too early on some things, you don't want to start too late on some things. So
yeah, exactly. Yeah. And I always say, I mean, obviously you may have known that you want to be a doctor for a very long time, but the actual, really cranking your application and really going towards starting playing the game of applying to medical school, that probably needs to happen a good year before. I mean, I hear of people who have done it very short notice, but A, it's stressful, and B, it's not very not as likely to succeed. So what I'll do is actually I'll take you quickly through the timeline now, and I think that will probably be the best way to quickly just lay out the process for people, so that anyone who's thinking of applying can kind of see where we go. So let's see if I can zoom in here. Okay, cool. So great. So let's say that so can you guys see all of it, or can you just see my like little screens of Zoom, or you can just see the whole screen?
See both.
See the whole thing. Okay, great. So what I'm doing here is showing you how it goes on a year-by-year basis. Okay, so the start point, if you will, the point that we work backwards from is where really when you start medical school. So let's pretend September, the year that you start medical school, and you're applying a year before that, and you should really prepare a year before that, and we're working backwards from there. So in the run-up to it, so in the year before you submit your application, you should really be focusing on your experience, your work experience, and your extracurricular activities, and also your aptitude tests. So it pays to know what medical schools you want to go to ahead of time. So really, in that year before, you should be trying to arrange 3 types of work experience. We'll come on to work experience to discuss it in more depth later in this webinar. But you want to be firing on all 3 aspects of the work experience, which is shadowing, volunteering, and regular paid work. Okay, and I'll leave it at that for now because we'll talk more about those elements when we talk about work experience. So that's what you should be aiming to do to gain in that time. Then also you need to start planning. So this is why you can get, if you go to futuredoc.co, you can get a copy of this PDF and actually add in your exams and your important, life events that you've got going on and plan around this. So then you'll need to, before you apply or around the time you apply, do your UCAT and your BMAT exam. So you can see here the ones in, let's see, what color are they? So green is the sittings of BMAT. Now this is kind of at the moment a bit up in the air because of COVID. And then there's the UCAT sittings as well. And you need to do it within those periods, okay? So for each of those, you probably want to allow, if you want to score highly and get into a top medical school or a high demanding medical school, you need to be scoring really well and need to be preparing probably for a good couple of months to do well. Okay, and then so applications are then they open in early September and they close in mid-October, and then you have your kind of interviews start kind of late November really to all the way up to end of March, kind of April time. So that's the path that you want to be thinking about. And whether you're applying from abroad or from the UK, you need to, you'll be applying to UCAS, and that is the way to do it, okay? And I probably won't go into grades and stuff now because that's quite a minefield depending on where you're from internationally. But there are a couple of YouTube videos I have, but like I say, the online course is very specific about all those things. So that's a really good place to get that. So I'll close that now. Nella, do you have any more comments about kind of the application process?
No, I think that PDF that you have is a really good one. I would have just said exactly that timeline because it's important to be ahead.
Yeah, exactly. And oh yeah, one thing I forgot is that obviously submitting your application, you need to be thinking about your personal statement. So same as your UCAT or your aptitude tests, I would say a good 2 months of preparation for your personal statement. Like obviously it's quite, it's only, 4,000 characters. So it's something that you can write fairly quickly, but it takes ages of planning it, thinking about what you want to write, actually writing it, then getting people to review it. It's a long process, so don't underestimate that. Okay, but I think the majority of people have done all of this and are aware of the process and are deep into it now and are up to their ears in it. So we'll come on to kind of the main thing, which is interview stations. Okay, so there are probably around 13 areas, maybe a bit less, maybe 11 or 12 areas that frequently come up at interview. Lots of subjects, things like the NHS, the MDT, insight into medicine, lots of common things that come up. So we're going to take a couple now and focus on those specifically. And the first one that we'll look at is breaking bad news, because this one is very much dreaded. Did you ever have to do some breaking bad news stations?
My interview was very different, so it didn't have stations. It was more of a panel. But I've had now, OSCEs in medical school for breaking bad news, and it is very, specific and what you should lead with and what to say, what not to say. It can seem like it's something very easy, but it can be very tricky. You tend to maybe try to overcompensate things like that if you don't know what you're doing. So I've had them at medical school in OSCE, and they can be quite difficult. But as long as you know what you're doing, I think systematically they're quite easy to do in the end. well, it's not easy, you know,
Yeah.
in the context of things, but.
No, absolutely. I think it's one of the most feared ones, really, because it can be very awkward. It can be really tricky for people. And so really the rule for doing well in these is to follow a guide, and have a plan of how the station's going to go, and then stick to that. And I'm going to talk about that now. So with Breaking Bad News, it's typically going to be in an MMI station, and it's going to be a role play type scenario, okay? And it's usually something that has occurred, and it's a situation that can't be resolved. So I'll come on to the tips that we give, but one of the things is that you're not trying to problem solve here. You're not trying to resolve a situation. What you're trying to do is handle the consequences of somebody receiving bad news. And that might be a reaction of whatever sorts, which I'll come on to explain. But it's how you handle that difficult situation, not trying to get out of it in some way. Okay. So yeah, one of the important things when you do the station, when you start any station, is that you'll have a minute to read what the station's about, familiarize yourself with the context, really make the most of that minute, really make sure you remember key names, important details of the scenario that you're about to go into. But also take a moment to think what skills are being tested, because you need to find a way to demonstrate the skills that are being asked of you from that station. Now, with Breaking Bad News, there are typically a few skills that they want to see you demonstrate. And those are good communication skills. They want to see that you can show empathy. It's obviously going to be an upsetting situation for the other person and for yourself. And they want to show that you can demonstrate empathy to be able to relate to that person. They then will have some sort of emotional outburst. It could be a big, loud emotional outburst where they get angry, or it could be a very, retracted response where they get quite sad and are, go into themselves a bit and don't speak and go quiet for a bit. And the final skill that they want to see is, and that's obviously how you handle those reactions from people. And then the final skill that they want to see is that you can admit fault, because more often than not, it will be something that you have done wrong, that you have caused to happen. And you, again, are not trying to worm your way out of it, make excuses, find ways to, some clever mental gymnastics to shirk the blame onto somebody else. That's not what it's about. It's, do you have the courage to admit that it's your fault? Okay. So talking about some of the communication skills. Well, actually, let's ask Nella, how do you feel about those skills? Do you think it's hard, or there's certain ways that you've seen people demonstrate those skills, or the way something maybe people have handled badly of those things?
Yeah, I think one of the important ones, like what you said, is handling a reaction from a patient, because sometimes you as a doctor almost have to be able to see like what's happening, because you could think someone going quiet means they've accepted the news, everything's fine, whereas you're more likely going to respond to someone who is having a more is it covert emotional response. But it's being able to detect it and then obviously respond to it. So I think that people can find very difficult. And also just what I found difficult personally is being straight to the point, and not dancing around and things like that. It comes with practice, and the more you do it, the more you know. But I think that's very difficult, because sometimes we think that we need to speak in a certain way, and you can not just be matter of fact about things and say what it is, obviously with empathy, but I found that quite difficult.
Absolutely.
I don't know whether you're going to ask questions, but someone was asking specifically about the breaking bad news to someone, but I think I can bring that up later if you want to.
Yeah, sure. Yeah, feel free to interrupt me at any point with any good questions that are kind of, good for the time. Yeah, of course, please do. So was there a particular question that
it was a question about, they saw a question about breaking bad news to a child of different ages, from 5 years old to 11 years old, and how you would break news to them. Does it change, especially if they have something like a serious like leukemia, and the parents didn't want them to know. So that's like it's everything that you've just kind of spoke about, like how to deal with all those scenarios.
Well, yeah, you can. So then you start getting into kind of Gillick competency and a lot of ethics. Now, I don't hear overtly of people having that complex of an issue. Those are such rare circumstances. It's definitely not something that I've come into contact with as a doctor. I've never had to deal with that situation myself. But it's definitely something that a senior doctor would be taking care of. The ethics of that, yeah, I mean, there's a big debate about the ethics of that, and that's probably best discussed in the, because we've got a lot to, Breaking Bad News is by far the biggest subject of this. So, you know, we'll do a medical ethics one again another time. But yeah, there's a lot of fat to chew with that one. So I think let's crack on with the Breaking Bad News stuff, and I'll come on to that at the end if we've got a bit of time. Okay, so things that they're testing with your, so as we said, communication skills, empathy, managing the emotional outbursts, and admitting fault where, you know, when it's warranted. So comm skills, you need to make sure you're thinking of both verbal and non-verbal. So it's about when you bring up the bad news in the scenario, how you're going to phrase it, how you take responsibility for it, and then your non-verbal stuff. So you have to have, you know, empathetic facial expressions. You have to have, you know, good eye contact with the patient, but at the same, or not necessarily patient. It could, sometimes it's a friend, or the scenarios that you've, you know, lost a friend's, you've misplaced their keys or something like that, and the house has been burgled. So lots of situations where it's not just patients, but yeah, maintaining good eye contact. And also not being too intense with eye contact, because it's a sad situation and they might be looking down, for example, because they're upset, and you don't want to be staring at them. So this is where the idea of mirroring comes in, where you match their level in everything, in body language, in eye contact, in the tone of voice and the volume that they speak at. So mirroring is a really good technique around this. Another thing with the communication things, the communication element, is to embrace silences, because when you've broken bad news to people, they need a moment to take that in. So that's an awkward moment of it, but it's one that's really important, because if you just fill the silence with, you know, nonsense that you're talking, then that in real life would be really inappropriate. Do you find difficulties with silences, Nella? I think that's a tricky one. You have to really hold your nerve, don't you?
You know what? I actually learned very early on. I think it was something completely different. It wasn't medical school related. It was a public speaking thing that I went to, and they talked about that, being comfortable in silence. So I'm very comfortable. Someone could be silent for a minute, and I would literally just sit there and wait. And it's one of those, people always want to break a silence, don't they? So that you feel awkward, so you want to just fill it in. But that is so important, and you meet that every single day with patients. You know, especially when you're taking history, for example. You have to be comfortable with silence, for sure. I learned that early on, but it can be very awkward.
Oh, Nella's got ice in her veins. Yeah, I think I find it hard to like just hold your nerve when the patient's got bad news, and not like want to say something to comfort them. But yeah, no, she's totally right. It's, you know, that ability to just let them speak and let them react how they need to react. So great. And then, so showing empathy. Again, so we can show this verbally and non-verbally with our facial expressions or the tone of voice that we use. And that's an important thing to consider when we're talking in these difficult scenarios. And then with managing the emotional outbursts. So my biggest advice for this is, do not think that if the patient has an outburst, or that when I say patient, I always mean, going forward, I mean, you know, the other person in the scenario, just to be clear. But if the actor has an emotional outburst, don't react to it, and don't be fazed by it, because they are directed to do that. They are not, it's not a sign that you are performing badly. It's just that they have been told to do that, and they want to see how you react to that, not whether or not you could cause an outburst. Okay, so be ready for it. And yeah, just I'll come on to what kind of reactions they can have and how you handle them. So and finally, yeah, like we said, admitting fault, that's part of the 6. You may be familiar. So on the interview course that I've made, I talk about the 6 C's of the NHS values. So so the C's which represent the values against which they recruit, and one of them is courage. So admitting fault shows courage. It shows that you have the ability to say and speak up when something you have done has caused an issue, and you're willing to admit that. So the breaking bad news stations will kind of, so this is your roadmap for the stations, and they will kind of go in 4 stages. The first one is how you kind of enter the scenario. So how you introduce yourself, where you position yourself. Are you facing the patient? Remember, dead on face to face is a bit confrontational, so try and be a little bit at an angle, but definitely facing towards them so that you can make good eye contact and exhibit good body language. And so it's all about how you start, and it's fine to start the conversation normally by asking them how they are. You don't want to come in really cheery, because you're about to, you don't want to get them up to here to then bring them down to here. But at the same time, you don't want to come in looking like the Grim Reaper, because you need to break the bad news to them empathetically, not come in showing it on your face before you've even said a word. Okay, so come in with a very kind of muted but not too somber expression. Okay, and then the next thing to do is deliver a warning shot, and this is simply explaining that bad news is about to be delivered. And it can be a really simple thing like saying, I'm really sorry, but I've got some bad news to tell you. Just, it prepares them and lets them brace themselves for what you're about to deliver. And then as soon as you've done that, you need to go ahead straight away and deliver the bad news. And this is what Nella was saying before, is that you don't want to mince your words here. You want to tell them without any confusion what has happened. And that means that if someone has died, like say, for example, it's common, a pet has died, that is a common scenario. You say, I'm really sorry to tell you, but you would use the name of the pet. So let's say Rover has died. So there's no ambiguity or any doubt as to what has happened, okay? And that might sound cruel, but I think, well, it's well accepted, and it's true that delivering it any other way than being direct about this is more cruel, because at the end of the day, you can't change what has happened, and mincing your words about it or fluffing around the harsh reality of what's happened is not helping anybody. And then once that's done, you wait. So this is where you employ that silence. You deliver the bad news, and then you wait. Embrace the silence, like be comfortable in the silence, let the news sink in, and give them a moment to react. And then it's about managing the reaction, and that's essentially it. Once you've managed their reaction, you just will round off the scenario by agreeing a reasonable action plan, that how you're going to deal with whatever the situation is next. So say if somebody's had their car stolen, you're going to go and report it to the police. You need to give reasonable action plans. I know it's not really a plan per se, it's a condolence and what you're going to do to at least take steps to make a bad situation slightly better. But you can't say something like, your car's been stolen, let's go and buy you a new car. That's just, or I'll buy you a new car. That's a bit ridiculous. So it's reasonable steps to kind of help comfort the situation. So whether that is, I'll help you go and report it to the police, or I'll help you with phoning your dad to tell them what's happened, or, whatever it is to take steps to help ameliorate the situation. Any comments there, Nella?
Yeah, I think I would say the same thing. I think a few people were asking in the comments about how this applies online. And Ashley actually has a whole video on his YouTube about this, about how to do your interview prep on online. And I'd say it's the same thing. So because sometimes you can think it's different. For example, like your screen, if it's like this, you can see my body language, if as opposed to if I was here doing the interview. So it's about positioning yourself. And like I said, he has a whole video, and I think it's part of the course as well, I'm not sure, but so I would answer it that way, just for those asking in the comments about how to do it online. Or if it's the eye contact thing that Ash just mentioned about, you obviously don't want to be direct, you can still do the exact same thing even on the computer, and look into the what you call it, the lens,
The lens, yeah.
into the screen, so that it looks like you've got eye contact. But things can change like that. But I would, I agree with you with everything. I was just tailoring it to some of the questions. They were asking a lot about how to
exhibit good body language online. Yeah, absolutely. So Nella made I was just thinking it as you said it. Nella's given a great example of how you should frame your online interview. You can see, you kind of from the mid chest, like upper abdomen up, bit of breathing space above the head. You can see her arms. I, on the other hand, I know this is not a medical interview, but I, on the other hand, am the opposite. I've got my mean mug right in your face, right, filling up the screen. But obviously, I'm not interviewing, so I wouldn't do it like this for that. But actually, as it happens, Nella is exhibiting a great example of how you should do it. And in terms of adapting your body language, so this is really going to be about using a lot of facial expressions, a lot of nodding, a lot of being really sympathetic. You can even, so like, Nella, can you just like lean forward as if you were like leaning into the patient? Yeah, so you can see how she's leaning forward and kind of showing a lot more connection and empathy and engagement.
As opposed
and those are the little things that, rather than, exactly, if you were to slouch back or just sit as you were before, just little touches like that will make a big difference. It's really hard. The non-verbal stuff is hard online. I make no bones about that. But you can also do it in your tone of voice, and your voice will be a much bigger tool in this, and the way you say things, the way you phrase things. Like I say, allowing those silences are going to be a bigger ace up your sleeve than they would under normal circumstances. One thing I will say about body language and connecting with the patient, whatever scenario that you're in, if you're in person, just don't touch the patient. Okay, don't touch the actor. You might mean well, but it doesn't always necessarily come across like that, especially if it's in any scenario really, but it can be misinterpreted. So just don't take that risk. You can show lots of good body language and good empathy enough other ways to not kind of go into that minefield. Okay, cool. Okay, so we've talked about most of the steps. I was kind of just maybe go through a few of the individual steps a bit more. So initiating the bad news. So you want to do that quite early on, because the more you let the person talk, it's because they'll want to, if it's a friend, a lot of times the situation is a friend. If it's a friend, they'll just, jabber away the same you would with a normal friend. You just start talking and, discussing life. So you want to kind of let them talk a little bit, but at the first available opportunity to get in there with your warning shot, start straight away. So the warning shot, like I said, it needs to let the person know that some bad news is coming and be to the point, that as your delivery does as well. So something like, I'm afraid I have some bad news, or I'm sorry, but something bad has happened that I need to tell you about. And then, like I say, you make no delays in then delivering the bad news itself. And it's important to make it clear, and then you just give them a bit of breathing space and wait for the reaction. And then so the reactions that you can kind of get are anger, and this could be anything from shouting, screaming, and you even hear of people being sworn at. Sadness, they might start blaming you. If it's something that's your fault, remember to admit that and apologize. Don't grovel, but just be very sorry. And then they might just ask you a lot more questions and want to clarify what's happened. So with anger, when it comes to dealing with anger, firstly, let them finish. Don't try and interrupt them. Don't shout over them. Don't raise yourself to their level. Stay calm and wait for them to come back down to you. And that's actually true in real life. You know, as a doctor, you will get shouted at a lot. Well, not that much, but hopefully not that much. I don't get shouted at that much, but you know, even being a very empathetic, good doctor, I get on well. I get on really well with, you know, most patients, but still, when emotions are high around their health, people will get shouted at. And it's important to stay calm, and they will eventually, I mean, if nothing else, they feel a bit ridiculous shouting at you nonstop and you're just speaking to them in a very calm, quiet voice. Nella's nodding. I think she, yeah.
Yeah,
Have
no,
you had that experience?
yeah, definitely, yeah. Because like what you said, it's like the mirroring. Basically, someone will mirror you for the most part. If they, you know, if they're shouting and you stay calm, eventually they'll realize what's happening in the room, and then they will mirror you, and they will calm down. In real life, but also even with the actors, that's what they want you to see, how you will react to that certain situation. So if you get flustered, or if you start trying to calm them down and, oh, I'm so sorry, you know, like groveling, like you said, that's not what you're supposed to be doing, because it's just testing you. So don't get flustered in that anger part. They're just testing to see how you're reacting to it, which should be to remain calm, because that's what's expected of you as a doctor.
Yeah, 100%. Yeah, good. Yeah, good point. So yeah, so like Nella says, let them kind of come back down to your level. Stay calm. You can acknowledge that they're angry. That's a very good way to kind of show empathy as well. Is like, I can understand that you must be really angry right, or say, I see that you're angry right now. Try not to quantify it too much. I think if you say things like, I see that you're quite upset, it provokes people to be like, oh, quite upset, I'm quite upset, I'm really upset. So don't ever quantify it. You can say like, God, I can't imagine how upset you must be right now, or yeah, I can imagine you must be angry right now, and never say things that kind of will maybe quantify or belittle just how upset or angry they are. So yeah, just the phrasing is really important, and it's only subtle words here and there. But if you prepare just a few sentences for what you're gonna say in that situation, then you know you'll have them up there to deliver when, you know, in crunch time, when you're under pressure. And yeah, so that's really it for anger, and just making sure to remember to admit when you're wrong. Okay, and then with sadness, it's kind of the same. You want to acknowledge that they're sad, and like I say, don't quantify it. You can just see, I can see how upsetting this must be for you. You can see the different. Can you see the subtle difference between saying, I can see how upsetting this must be for you, versus I can see that you're quite upset? Because I remember when I was first working as a doctor, I had said that to a patient. In fact, sorry, it was when I started working I worked as a prison doctor for a bit. It was quite a fun time, that. And on one of my first days as a prison doctor, I had a patient who was arrested and really upset that she was separated from her children. And I said, God, I can see you quite upset. And that's where she went, quite upset. Do you have children? Blah, blah, blah. And like, you know, when emotions are high like that, just a small word can really set people off. Okay. And then, yeah, like I said, rounding off the scenario, just come up with a reasonable plan, a plan of action that you're going to take. And it could be something as simple as, like I said, going to the police station to report it, or letting their partner know, or the rest of their family know. And you know, even things like, if it's, you know, even making, you know, we're in Britain, making people offering people a cup of tea, that little things like that, just to show that you care and that you're there for them and that you're supporting them. Cool. So that's pretty much it for Breaking Bad News. Nell, have you seen any good questions that we should?
I answered most of them. Most people were asking about what, like the how you enter a conversation, like what you should say, how to react to angry patients. relatives, why two questions, I guess, if someone didn't understand, clarify. Why should you not try to calm them down in a situation, because we were saying if someone's angry, don't try to calm them. Well, I don't think that's what we meant exactly, but
yeah, it's not that you're not trying to calm them down, it's that you are calming them down by being empathetic and calm yourself. So you are saying things that you're staying away from things that might aggravate the situation. So like Nella was saying before, when you're fussing them and you're getting in their face, you're being quite high anxiety yourself, and that just perpetuates the situation. Just let them, I think most people, when anyone gets angry once in a while, and sometimes people just want to just let it out quickly, if it's usually these situations are justified to be angry for. Sometimes people just need to have a quick outburst to let their emotions be known, and then they kind of come to terms with it. Not come to terms with it fully, but kind of bring themselves back round, and they are a bit more orientated and calm themselves down. And one of the things that I talk about on the online course is it's the reasons people get angry. So people get angry because they may have thought that you don't realize how angry they are. So if they think that you don't realize they're angry, they're going to shout to make you realize that they are angry, which is why saying, I can see you're angry right now. And the other thing is that they might get angry because they don't think that you realize you're at fault for it, which is again why we say admitting fault. And this is what I'm saying. I mean, you can check out the online course. We go into a lot more depth with all of these, and those are where the nooks and crannies of the questions get answered. But there's reasoning behind the suggestions that we've made, and that's one of them.
Yeah, I think that was all of the questions. Just one more that keeps coming up is people about action plan when someone's passed away, which, there's algorithms for stuff like that in the hospitals about how to escalate. When someone has passed away, basically, what would be the action plan? Like, what's the last thing you say to someone? Or do you say passed away and died and things like that? But the specific question is, what's the action plan?
It will be relative to the scenario, okay, and they will give you clues, and this is true for all scenarios. So they might be like, oh God, how am I going to tell my parents, or things like it's one of those things that you can't be too formulaic. Don't say, if someone has died, I am going to ... Like, say, I think it's unlikely that it will be a hospital scenario where a relative has died. It's usually something that's relative to what your guys' real life experience would feasibly be at kind of the age of what is normally under 18, excluding grad applicants, of course. But so it will be like real life scenarios where a pet has died, rather than you having to break it into in hospital that a relative has died. So yeah, a course of action would be, like I say, going to things like going to tell the parents, just offering them some consolation. If like, for example, they might want to go and see the pet, or if that's what you would do if it was a real person. You probably often people want to go and visit the body, for example, and then if it's a pet, you probably bury it quite quickly. So things like that. But again, these are just suggestions. I don't think you should be too set in stone with what you're going to say to wrap up the scenario. Okay, that is one of those things that you're going to just have to judge based on how the actor's responding and the particular things that they're saying.
I was just going to add a little bit as well on what you're saying with the scenarios. A lot of the questions that we're getting, it's not necessarily getting bogged down on the exact thing you're going to say as in the exact action plan, because it's not necessarily about what action plan you're going to take if someone's died. It's how are you handling the situation, the things that Ashley just been going through. How are you communicating? How are you reacting to emotion? How reasonable are you with the situation? And it's not going to be things where you've never been in a situation you've never been in. It's a situation that you should be in. And, you know, if your friend's pet's died, what would you do? You know, in a normal situation, you would, you know, you'd apologize. You would ask, you know, what they want to do. Would they want to see the pet? How they want this, you know. So it's also using not common sense, but kind of in how you would if it with a normal person. So I wouldn't get too worried about the exact thing, you know, what my action plan is going to be and things like that. It's more
yeah, Nella's touched on a really good thing. Actually, that's another thing from the course. One of the biggest bits of advice we give is literally imagine what it would be like. Imagine that it really happened. What would you say? And you know that if you're in that situation, you would find the right words. And just imagine it. Imagine if it was happening to you, what would you want to hear? And that is probably the best guide to how to find what to say, really. Cool. Okay. So I'm deciding what. So I think I said we'd be about an hour to an hour and a half. We're already an hour in, and we've got a whole nother topic to go. I was maybe going to do a scenario, but I always tend to lose my voice with these long sessions, so I don't know if I've got it in me to be an actor right now. Well, I'll leave it to you guys. Let's see. If the actor is acting as a friend, can you be a little bit more formal? Act as the situation and the context suggests. If it's a patient, be formal. If it's a friend, act like you would with a friend. Just, again, the advice of how would you be in real life. Yeah. Okay, I think we'll move on to work experience because we've got a bit of stuff to cover. And so, obviously, I've talked about work experience before, but this is actually how we're going to answer work experience questions at interview. And as we said, work experience is the backbone of your application. It is your fail-safe when they back you into a corner and ask you for a story that you have not prepared for, or the context changes slightly and the example that you had planned doesn't really apply or isn't really relevant. I had this so many times. Well, at interview, I had it a few times where they really kind of like find a very specific way of asking a question that I would have never been able to prepare for. And it's genuine experiences from my real work experience that helped me come up with an answer. So yeah, it's really going to help you. And obviously, of course, it shows dedication to the career and understanding of medicine, insight, lots to be gained from good work experience. So I know the questions are going to be a lot about work experience in COVID, and don't worry, I will come on to that. So remember, there are 3 types of work experience. There's regular paid work, shadowing, and volunteering. And remember that they are all equally valuable. Not one doesn't trump the other. Obviously, shadowing is the one that people worry about the most, but they all have their place and they're all important. Okay, so paid work is really important because you're showing transferable skills, you're showing reliability. If you're if you're client facing, let's say you work in a shop, you'll have to demonstrate communication skills, and occasionally people will complain. So that is, breaking bad news, tricky communication, and how you adapt to that. These are all skills that are required to be exercised during a regular paid job. You'll have to work in a team, and say, for example, if you're handling money or even having the keys to the property, you need to show that you're honest and you're trustworthy with those sorts of things. So those are the main skills that regular paid work exhibits. Any thoughts on that, Nella?
Yeah, I like what you said about the skills that you're trying to see the relationship, basically. So when you're asked in an interview about something, is something like what you said, something as simple as being the person that opens at the beginning of a shift. You don't realize that what's that exhibiting? That's exhibiting responsibility and honesty, like you said. So it's trying to pick out what it is from that experience that relates to medicine. It kind of, you might touch on it later as well. If you have non-medical experience, sometimes it doesn't matter, because it's what skills is it that you can apply to it. That's something that helped me a lot when I first applied, because I didn't have loads of work experience in terms of in a hospital, but I did have a lot of like outside of medical medicine experience. I worked in a bank for a long time, so obviously I could handle pressure. I worked in a call center, and being able to handle people calling you, complaining and shouting at you down the phone. So it's things like that you can marry between what they ask, what do they want to see that you can exhibit, basically.
I think if you can handle it in a call center for a day, you can handle any breaking bad news scenario.
Yeah, absolutely.
Yeah, and that's a question that I get a lot from my students is, or maybe a statement. They'll say, "Oh, well, I only did this, or I only did that." It's not like you shouldn't rank experiences. You should see what you got from them. So it's all about, and yeah, Nella said a great word there, transferable skills. It's so important. And you might have done what on paper looks like a rubbish job doing this, but it might have taught you so much. And actually, the lessons that you gained and the things that will translate to you being a good doctor might be way better than your shadowing experience. If it's a really good lesson that you've learned, and that will sound good, especially if you've got a genuine example, it will come across very well at interview. So shadowing obviously is very hard at the moment, and I will talk about alternative ways. And there are lots, and you need to get creative, really. But there are some standard ones that kind of make up for the usual hurdles that we've got at the moment. So, but before that, let's go on to shadowing, kind of like 5 golden rules for shadowing. So the first one is keep a log. You forget how much you forget. People at the time just think, oh, I'll never forget this, but you'll forget the little details. And remember that your work experience may be a long way back. It might, and then you don't know, even if you did it right before you submitted your application, you don't know how long it's going to be until you interview. So before and with that log, when you're about to interview, make sure you read it the day before, so you can put yourself back into that, jog your memory, put yourself back into that scenario, and remember it's the real intricate detail that's going to help you paint the picture and really tell the story more convincingly. Okay. Then, so the second rule is, so if you had difficulty in getting work experience, just add in a little sentence to show how hard it was, because a lot of people have struggled this year. And if you were persistent, and let's face it, a bit lucky this year, but in the past, if you were persistent with how you arranged your work experience, that shows dedication, that shows commitment. So just a little line like, tell the story of how you came about getting it. So I contacted my local hospital. It was a bit difficult at first. I didn't hear back, but I kept calling and emailing until finally this doctor allowed me to come and shadow them for a couple of weeks in this department, and then you go on to it. Okay. Another, the third golden rule is, it's not necessarily what you did, but it's your ability to reflect on it. As we said before, it's how you explain your experience will contribute to you being a good doctor, developing a skill, opening your eyes to something that will help contribute to your medical school career or your medical career after that. One of the things that people hate is dropping names. Most probably, even if they're a big name in their specialty, other specialties and other doctors, like some, interview panels are sometimes GPs or whatever. They won't know the best renal physician in the country. They just, and it just comes across badly, and people don't really don't respond well to it. So just avoid being a name dropper. Just say what you did without including the name. And also on that point, there's actually a lot to be said for the opposite, which is doing not so glamorous, gritty placement, let's say in care of the elderly, where it's not, you're not seeing particularly nice things. And actually, if you still want to be a doctor after seeing that, then that's a lot better than someone who got a fancy placement with a high-flying professor through a friend of a friend. So yeah, any thoughts on that, Nella?
Oh, yeah. I agree. I don't really have anything else to add. I was just thinking everything you said.
I concur.
Yeah.
Cool. And then the final golden rule is to always use the structure of what you did, what you learned, and relate it back to how it will make you a good doctor. That's kind of coinciding with point 3, where I was saying about reflection, but that's the structure that you should always use when, I mean, it's how I teach it in the personal statement course as well. But that's always how you should frame it, written down on your personal statement, but also verbally when you're talking at an interview, okay? So when you're asked a question, something along the lines of, tell me about your personal, tell me about your personal statement, tell me about your work experience. So the best way is there are ways of phrasing it that subtly tell them that you've done a lot more than just one placement. For example, you can start with a broad sweeping statement about, well, I did lots of work experience placements. I did a week in the GP. I did a week shadowing in hospital, with a neurosurgeon. And you can say like 3 or 4 things and then go into the actual experience. And so that when they say, tell me about your work experience, you'll say, well, I've done quite a few work experience placements. I did this, 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 and this, but the most notable one was ... And then you go into the structure of what you did, what you learned, and your reflection on it as to, linking it back to why it will make you a great doctor. Okay. Did you follow that structure, Nella?
Yeah, basically from even how you write your personal statements, the same way kind of thing. So yeah, I did the same thing in my panel interview, because it was, I got some of those questions, why medicine, for example, is one of those questions that, I think a bit, it can seem easier than it is, but it was the same thing. You wouldn't think to put that kind of structure even in that kind of question, but you would. Why medicine? This is why I did this at this point, and then from that I learned this, and then because of this is why I wanted to do medicine. And even if someone hasn't asked you about your work experience, it's something that you can put it in because of that. Well, why medicine? Because when I did this, and this, I did this in this specific one, I learned this, and from that experience that I saw these doctors doing this, it made me realize that I want to be a doctor instead of a nurse, and so on. So I think it's a perfect structure, and you don't have to, it's not something that you have to memorize. If you memorize those 3 steps, it will just come naturally the more you practice as well.
Yeah, 100%. And it's like natural storytelling, really, and it weaves a good narrative into it, and humans respond better to stories than just random facts. So that's a good way for when you're trying to remember random stuff at medical school. If you can put it into a story, that's like a well-proven memory technique. So yeah, and at that point you can also, remember I was saying, you can subtly add in little bits of spice that help make it sound better than it is. So at that point you can even add in a sentence of like the struggle that you went through to get that particular placement. Just say, something really simple like, it took a lot of organizing, but I finally managed to get a placement at my local hospital, and this experience did this, and then you go into the 3 steps.
Yeah, I was just going to add quickly as well. Someone had said, can you
Mm-hmm.
apply to medical school with virtual work experience and shadowing? I didn't know people were doing that, but I think that's even a way you could put that on your side. Like if you were to show that you were that persistent, that you were willing to do virtual work experience instead of physical, because some people just think, oh well, I'm going to give up then if I can't get one. But it's a way that you can use that to show that you are dedicated. I didn't know people were doing virtual work experience, but I guess that's... Yeah,
so later in this I'll talk about where you can go to get alternative work experiences. So yeah, what was I going to, you made me think of something there. So yeah, just give me 1 second, it'll come back to me. No, it's gone. Oh yeah, that was it. So this lockdown will have left 2 types of candidates. It will have people who have basically used it as an excuse to do absolutely nothing, or people who have found a way to get very creative about what they do, and really is an opportunity, or kind of has forced people to do stuff that makes them stand out. So I remember one of my students, and this was really early on when there was a real mask problem, of an issue with having enough supply of masks. And she learned how to make them. She literally taught herself how to make masks that met the regulations and were effective, and started sending them to the local hospital or to the local care homes. I think at the time care homes were having a real tough time with PPE. And like, think about how impressive that is. And if you're reading that as a selector, that's just a really great thing that makes people stand out. So yeah, it's an opportunity to definitely be a bit different, and yeah, do something that does stand out from the crowd. So right. Oh, and yeah, another thing to remember, that your work experience is, you can be very mature and show signs of maturity and of commitment to medicine by mentioning that you picked up on the downsides of medicine as well, that maybe you saw a sad case which actually you thought was quite emotionally upsetting for you, and then talk about how you spoke to one of the doctors and you tried to understand how they deal with that and what their coping mechanisms are. And then remember, we're relating it back to how that would make you a good doctor. So you learned from that person the coping mechanisms that they adopted, and now you're going to use those when you see something upsetting when you were at medical school. Yeah. So any more thoughts or any questions, Nella, that I might have missed?
No, I think that was
no. Cool. So I'll come on to alternatives now. Obviously, I don't know if you guys have heard, but there's like some virus that's been affecting the world this year. I don't know if you guys picked up on that, but obviously everybody has had their work experience jeopardized, and some people haven't gained, hospital shadowing, should I say, and people have not been able to gain, all elements of work experience, but shadowing is the one that has stumped people the most. So in that situation, you need to start taking a step back and thinking, well, what is work experience, or in particular, what is shadowing trying to get out of you? What is the point of making you do shadowing? Okay. And there are a few things. There are for them to help you realize what the job's like, what life will be like as a doctor and as a medical student. So it helps you gain insight into medicine and how the hospital works. It's helping you understand the positives and the negatives of being a doctor. It's also showing that you have the dedication and the kind of gumption to go ahead and organize your own placement, and willingness to go and do that to show your commitment to medicine. And finally, it's also showing that you have got the resilience to put up with some of the harder aspects of hospital life and being a medic. And so you can think of ways outside the box that you can demonstrate those. And that might mean you taking action into your own hands. And like, for example, Nella's a great example. She is someone who will give you a look into what her life is like as a medical student. She explains it. She explains some of the things she's going through. She just released a really good video about her first work experience placement. That gives you a flavor of what it's going to be like. And I think, am I right in thinking, Nella, that you talked about some of the downsides as well that you've seen?
Yeah, I have, because I did I think previously, like in the past, even in terms of like mental health and things like that, which is quite a big thing at the moment to talk about. I've definitely talked about it in both as a student, like personally, and also as as a medic. I've talked about it because obviously that's one of the things that you'd be expected to have a real understanding of what it's going to be like to be a medical student, not just a doctor, because I mean, you're going to be a medical student first before you're a doctor. So, you know, the pressure and things like that, and the workload and stuff. So it's things to know how to be able to share, to talk about the downsides, and your real understanding and reality of that, you know, basically what you're going into.
Yeah, exactly. And so, you know, we're trying to gain insight into that, and looking at people like Nella are a great way to do that. There's also, you know, you can even contact your local GP and arrange that if they're kind, and usually they're willing, you can just have a 10-minute conversation with them, just to ask them what their life's like as a doctor, you know, try and get a flavor for what just their day-to-day life is like. And then when we want something a bit formal, we were talking about some work. In fact, I'll just copy and paste this. So some of the best places to go for work experience. Now, bear in mind that a lot of people will have done these, but obviously it's a great experience. So that is the Brighton and Sussex Medical School do online virtual work experience, and then there's a GP equivalent which is called Observe GP. So that's really, really good. Yeah. So yeah, I think again, just talk about the skills that are expected from. Sorry, I'll talk about volunteering. In fact, what work experience did you do, Nella, before?
I volunteered since I was 16, all the way up until I applied for all the way through, because I really enjoyed it. I did that voluntary work. I worked as a carer and HCA since I was 18. So that was my paid work. And then I never actually got to shadow any doctors. But those two were enough for the first time round to be able to write about in a personal statement to get an interview. So I think those are the main ones. And I did, I think I don't even remember. It was like 9 years ago.
Yeah.
I did think how long it was ago. It was so long ago. But I think those are the main ones. But I think it even answers one of the questions that someone says, if I did a work experience in 2017, does it still count? As long as you can, you know, like what Ashley's just been talking about, as long as you can do those 3 steps about that work experience, and you remember it, and you can talk what you did, what you learned, how, you know, it's completely fine. I mean, also it shows, you know, if you don't log it, you won't remember it because I don't remember it. But yeah, I think that's what I did. I did paid work and voluntary work. That was my.
Yeah, we should come up with a phrase like "log it or lose it" or something like that.
Yeah, definitely.
No, timeline is irrelevant. I mean, obviously it needs to be recent enough that you can remember it, but yeah, your timeline doesn't matter so much, and nobody's, you know, it's how you phrase it. Nobody's going, and when did you do that placement? What year was it? Oh, it was 25 months ago rather than 23 months ago. Oh, that's over 2 years, and that no longer counts. Like, nobody's speaking like that. And you don't need to. I get a lot of my students are afraid of this. They're like, oh my God, like I'm going to get found out. It's not when you did it, it's the fact that you did it. And that's all that matters. And it's more importantly, what you learn from it. Yeah. So finally, I've just got a couple more points about volunteering. So volunteering is obviously another important aspect of the 3 elements of work experience. And the skills or the character traits that you're showing from volunteering are commitment and self-sacrifice, empathy, again, because you know you probably will be doing it in a charity or maybe in a care home, and the communication skills are tested there, because you may have to communicate with, let's say it's a dementia care home, or you know, I mean, in a care home, it's people who probably will have communication issues in one way or another, and you have to show how you adapt to that. And it can be disadvantaged people or people with hearing difficulties, for example, when you have to adapt how you communicate with them. It's a really good test of that. And again, it's good exposure to healthcare, whether it be in a hospital. I'm sure you guys, if you know me, you may have heard of how I got into medicine, which was I worked giving the sandwiches out at my local hospital, and that was paid work. And then off the back of that, I got some volunteering in the hospital, which was simple things like going around and talking to the patients. That's all I did. I literally went around and chatted to them about life. And, you know, when you're in hospital and you're bored and even especially the elderly people, that they really like that. If they've not had a visitor that day, it's good for them and helpful for them to just have someone to have a reasonable conversation with them, keep them sane for a bit. Yeah. So yeah, so that's volunteering. And if you want, volunteering is similar to work experience. It's been a bit compromised this year because of COVID, but there are still ways around it. You can find, I mean, a bit of creativity and a bit of Google searching will find you a good volunteering experience. And it, like, even in my local area, for example, and every local area has this, there's things like still today, we need to get shopping for people who are shielding, or, you know, be able to socially, safely and in a social distance manner, go and provide a bit of comfort and support to these people. So just, again, same as what I was doing in the hospital, going and having a chat with somebody. So here is, so the other thing where you can get a kind of a bit more of an official place to go for volunteering is the Royal Volunteering Service.org. But you can just, that's in the chat there. Sorry, the Royal Voluntary Service.org, and that's a good place to go. So yeah, that and you know, between those you can get some really good experience and cover all three areas of work experience. So yeah, Nella, do you have any other thoughts, anything to add, or have you seen any good questions that I might have missed?
I think most of the questions, I think Ash will talk about it later, but he has all of these are answered on his course. A lot of them, people asking about the NHS and things like that. But I was like, how to find out if you get questions about the NHS, or how to find out how the NHS works. I'm guessing that's for people who are probably abroad. But I wanted to add on what you were saying about the voluntary work. If you've got, because now I remember from when I did it a few years back, my voluntary work, it's take initiative, because they found out I was a medical student at the time. I was doing it in a hospital at the time, and I didn't get any shadowing work, but sometimes the doctor would say, okay, do you want to see this, or do you want to follow me while I do this? So it wasn't like an official shadowing, but because I was volunteering and I was, you know, showed that I was eager and wanted to learn, I was able to do that as well. But I wanted to just add that on later on. So in whatever capacity you're in, if you're in a paid work and you are maybe a HCA or a carer and you are not qualified to do something, if you're working in a hospital, just ask the F1, for example, to just follow them around for a bit if it's allowed. Obviously, you have to go according to, you know, be professional and see if it's allowed according, you know, with your job. So I'll just add that. But I love the questions, I think. Yeah, thank you.
Yeah. A really good tip, that another thing that I teach in the course is that when you've done whatever work experience, shadowing, whatever it is, whichever of those three, ask the person who you shadowed, or your boss, or the person in charge of the volunteering, you know, the coordinator maybe, to write you a letter of recommendation. Because even if it goes nowhere, you can always take a record of achievement into the interview with you and show them, or you can give it to your referee, your school referee, to kind of corroborate in their teacher statement. Or, you know, you can just say, I got a letter of recommendation. I think I don't think you might, for example, if you're doing online interviews, you could probably share screen and show them it, or you can just reference it. But having that letter of recommendation is a really good way, because someone was asking about references, and that just jogged my memory for that. And I did that. I at the end got my consultant who I shadowed to say, I said, can you just write me a quick reference to say that you recommend me for medical school? And that was a really nice little thing that kind of vouches for you. So another doctor vouching for you when you go to medical school, and they're saying, well, another consultant, a doctor who's quite high up, has said that this guy has what it takes, and you know, that can only be favorable. Cool. At what point in the interview would you show the letter? Well, obviously, you, in that 3-step process, you would say, I learned this, this, and this, and it actually made me realize that I'm probably reasonably suited to medicine, because the doctor at the end gave me a letter of recommendation. And then I wouldn't say, do you want to see it? I'd just wait for them to kind of go, you know, do you have it? Or I was like, oh, actually, or you could just very like casually say, oh, I have that now actually, and I could share my screen and show it you if you'd like. Or you can, that's why I say is take your record of achievement with you if you want into interview, especially if you're someone who fidgets with their hands a lot. It's just something to hold on to and place in your lap so that you're not messing around with your hands too much. Cool. Okay, right. We are coming up to time, so I just want to quickly talk you through some resources that we can give you to help with interviews and with applying to medical school. So as you guys know, I've got lots of courses out now. I've got 5 courses. One is the A to Z, and I've got one whether you're an international student, and I've got a different one if you're a domestic student, and that gives you everything. So even if you're doing your interviews now, I'd still highly recommend it because it's so important to know the process. Remember what I said about when I went to that Medlink conference and I was like pulling my hair out because I'd missed all some key details. I was so grateful that I'd got them at that stage because it helped me go back and atone for them. And then that made me stronger for interviews. So that's one of the courses. The other one is that I've just released a 2021 interview course, which is 8 hours of video lessons. Then it has over 40 questions where we do questions, then model answers. And then I think it's 20 live examples of students doing mock scenarios, and I critique them and show you how to improve them. On top of that, if you're applying for next year, we've got 6 hours of UCAT training, we've got 6-hour BMAT training course, and then a 5-hour personal statement course. So because Nella came to me and said, like, look, I want to get a deal for, you know, my followers and you know, the people who keep asking me about this stuff. So what we've done is I normally sell all of these for like £50 to £100 each. And so I'd sell them individually. So 5 courses times, let's say, minimum £50. So that would be 250 quid. But actually, because it's Christmas and we're feeling charitable and you guys need all of these, I have done until midnight Christmas Eve, I'm doing a deal where you can get all 5 courses for unlimited access for £50. So you have 3 days to do that, and I'll give you the link, which kind of has a video. So make sure you get this link now. Is the link showing? I'm nervous about putting links in this chat now. Is it showing?
Yeah.
Yeah, cool. Yeah, so that has everything. It has all those 5 courses. I mean, together, I've not even added it up, but it must be over 30 hours of video lessons plus all the live examples and work throughs. So there's loads and loads of stuff. You basically got one resource for £50 that will, and remember that it has the PDFs from all the books that I literally, when I researched this course, and since I've been teaching this for 10 plus years, I've just got all the resources and condensed them into PDFs. So we have everything. We have absolutely everything. And that is what you'll need in a definitive resource to basically help you get into your first choice medical school. I remember that the students that I coach have still got 100% record. So there's a lot of good stuff in there and really useful and an absolute bargain for 50 quid if you get it in the next kind of 3 days or whatever midnight of Christmas Eve is. So yeah, have a look at that. And I think that's it really. So I'd like you guys to just please give a massive, massive round of applause to Nella. She's been amazing. She's been so good. Thank you so much for coming and doing this with me, because I really appreciate it. So in the reactions in the bottom corner, yeah, that's it. Lots of stuff in the chat. You can do rounds of applause in the reactions bar in the bottom right. Yeah, you can do everything, chats, whatever you want to do. But yeah, please show your appreciation to Nella, because she's been amazing. And yeah, do you have any final things you want to say, Nella, before we sign off?
I would just say that I was saying to Ash before that I wish that I had this before I applied to go abroad, because I know that I would have got in with help. like this, like your courses and things. So even if, like what you say, even if you are part of the interview, you've already got an interview, you know, you need all the help that you can get. And if you can get as much help as possible, then you should. So I would just implore, I mean, I get, you know, people asking me all the time, how to, and it's always the same questions. So just think, if you've got a question, someone else probably has the same question, and Ash probably answered it. So I would just implore people to do so, because it will help.
Yeah, and obviously and if you have any questions beyond that, I'm always there to answer them anyway to all my students. So that's fine. And yeah, remember that these sessions, they're an hour. Well, I think we did an hour and a half, but yeah, as in, you know, I've covered 2 topics in that hour. Remember, I said we've got, you know, in the 30 hours of videos, I go into so much depth with this stuff, and all those questions that you ask, I could talk for another 20 minutes, 30 minutes about those, but obviously we're time limited. So, and for some reason, every time I do this, I lose my voice. So I've got a finite amount of time that I can deliver these. So yeah, check out the courses. I think you'll really love them. And yeah, if you have any questions, you can reach out to us. Follow us both on Instagram and on YouTube, because we've got lots of good stuff, and we pretty much daily, weekly, regularly put out stuff to help you achieve getting into your top choice medical school.
Yeah.
So thank you guys. Thank you, Nella. Thanks so much.
You're welcome.
It's been an absolute pleasure. So take care, guys, and Merry Christmas, Happy New Year. And I think we'll be all glad to see the back of 2020, and I hope you have a good one wherever you are. So take care, guys.
Thank you. Bye.